collaborate and listen. Ice is back with a brand new invention. Something grabs a hold of me tightly, flow like a harpoon daily and nightly. Will it ever stop, yo? I don't know. Turn off the lights and I'll glow to the extreme. I'll ride like a vandal. Light up stage, makes a chump like a candle. Dance! I think I smell some ozone. Or, well, maybe it's just me because I've been wearing this for like the past 8 days. I'm just joking, guys. Every once in a while I'm in quarantine, I like to clean up at least a little bit. But anyway, you can actually smell ozone, and we'll get into ozone here in this chapter. So this is going to be looking at pollutants. So some of the major ones that we need to look at, carbon monoxide is probably one of the biggest ones. And nitrogen dioxide, also the ozone. And in fact, I got a little device here that I want to talk about at the end. We'll describe that. But also maybe some of the particulates, pollen, bacteria, anything like that. So that's what we're going to be getting into in this chapter and looking at how that could affect performance. And from a physiological standpoint, what are these things doing? So I hope you enjoyed the chapter, and it's a fairly short one. So without any further ado, here is pollutants. Exercise in polluted environments. So we're going to be looking at substances and molecules that can affect you while you're exercising. From a physiological standpoint, some of these are going to be a hindrance upon performance, but also your health. We're going to start this off by looking at the Beijing Olympics a few years ago. There was actually an Ethiopian Olympian who actually had to drop out of the competitions because they had what's known as EIA, or exercise-induced asthma. And this exercise-induced asthma was actually brought on by the pollution in Beijing. If you look back at some of the videos from the Olympics and some of the stories that were leading up to it, there was somewhat of a big problem with some of the pollution that was there. And actually, some of the athletes stayed in Singapore before the Olympics so that they could train there in cleaner air, but then go to Beijing while they needed to do the competition. But it still was a hindrance on their performance. Now, one thing to keep in mind is that there is still limited research on this topic, because the experimental data to have control subjects as well as a controlled setting is almost nothing, because there's some ethical concerns about telling somebody that we're going to expose you to a certain level of pollutants that we know can potentially harm you, and we're going to see what your performance is at the end or during that exposure. So it's not very ethical to actually perform some of these trials on humans. So the best data that we have are people that are exposed to these environments a lot or certain periods of time and then test them pre and post exposure. And that's where a lot of the EPA studies on pollutants in humans comes from. So they're looking at different cohorts versus randomly selecting subjects. All right, let's look at the first one here. One of the pollutants, big one that we probably all have breathed in at some point, would be carbon monoxide. If you've ever sat around a campfire, you've breathed in carbon monoxide, maybe not to very high levels because it should be an open air environment. But if you've been in a fire or anything like that, then yes, you're going to be breathing in carbon monoxide. So the problem with this is that it alters the carrying capacity of oxygen on the hemoglobin. And I have a couple different figures down here, and you can look into some of the details surrounding them. The oxyhemoglobin association curves or dissociation curves. Basically what these are showing is how attractive oxygen is to hemoglobin, and that hemoglobin in the red blood cells. So even though oxygen is very attracted to hemoglobin in the red blood cells, carbon monoxide is also very attracted to it as well. And it doesn't like to let go. It has 200 times the affinity or binding capabilities to hemoglobin than does oxygen. So this is the problem with carbon monoxide. We breathe it in and it gets stuck to the hemoglobin and it doesn't like to let go, or the hemoglobin doesn't like to let it go. So we have this carbon monoxide that just continuously gets built up if we continue to be in this environment, and it takes a very long time for it to be released and we can get rid of it. So 50% of this binding to the hemoglobin in our body, so meaning that if 50% of the hemoglobin has carbon monoxide bound to it, or if there is a 50% saturation of carbon monoxide versus oxygen, then we're going to start to have some life-threatening situations. Looking at carbon monoxide binding and the performance decrements. So roughly 40 to 50% of that binding, or that percentage of binding, actually impairs the low intensity activity. So just not the higher intensity exercises, but also low intensity exercises. In fact, when this was studied, there was actually a lot of fainting that occurred in many subjects. And this study was done in 1941. Things were different back then. There was also some things going on in Germany. You can read about some of that where they were looking at some of these pollutants as well. About 10 to 20% showed actually really no change at all in the submaximal performance. Submaximal meaning any exercise or any activity less than maximal effort. So there was an increase in heart rate as well as VE, which is ventilation, which sounds somewhat obvious because if there is more waste in the body's reaction is to increase heart rate, to get rid of that, to bring it back to the lungs so we can breathe it out, and therefore the breathing rate will then increase as well. And lastly, VO2 max is inversely related to the hemoglobin carbon monoxide association, meaning that as carbon monoxide rises, the VO2 max then decreases and vice versa. And the mechanisms with this carbon monoxide, so we have an hypoxic situation. So it binds to hemoglobin as well as the myoglobin, and that myoglobin is similar to hemoglobin. There's some structural differences within it, but it's very similar to hemoglobin, but it's located within the muscles. It is the oxygen carrying cell within the muscles, and it can affect the cytochrome molecules. Basically, this means that it's blocking production of energy, or the ATP molecules, when we go through aerobic metabolism, because we don't really have any oxygen, or we have less and less oxygen to go through aerobic metabolism, and the aerobic metabolism itself is being blocked. And in environmental physiology, if there's one thing to take away from this class, it is that if you have one situation, environmental scenario, you're going to have a decrement in performance, likely. But if you add in another scenario with that on top of the initial environment, then you're going to have even more problems. In fact, this effect of carbon monoxide on performance is now exacerbated because of altitude. If you're at a high altitude, maybe in a city that has a lot of smog, or maybe in a fire or somewhere like that. Switching gears to nitrogen dioxide. So this is seen in exhaust, firefighting, and also in smoking as well. On the lower level of exposure, there's really no effects on submaximal performance, maybe except those with pre-existing respiratory diseases. Now, low levels are seen at peak levels in the city, in urban environments. That sounds somewhat confusing. I probably should have reworded it somehow, but what that's meaning is the low levels of the exposure are seen at peak levels during the day within an urban environment or a city, especially a major city. So there's not a whole lot of risk maybe out in the suburbs or a rural area. High levels can actually cause pulmonary dysfunction as well as exercise time. So the amount of time it takes to run a certain distance, and the aerobic metabolism is going to be affected with this as well. Moving on to fine particles. So this includes dust, smoke, pollen, any type of bacteria, any sulfur fuels that are in the air. So there's human factors as well as environmental factors with this. So some human factors would be things that we are creating, we are putting into the air, into the atmosphere. The environmental factors, these are things that are just naturally found in the air. The big one being pollen or potentially bacteria, and even dust. Now, you could make the case that smoke and sulfur fuels are also environmentally related too, depending upon how the fires and how these substances are released. If it's from a volcano, that's obviously environmental. If it's from a forest fire that could have started naturally, then that is an environmental factor. But it could be a human factor as well if it was set on purpose or accident. And large particles can be trapped in the nasal cavity, which can limit breathing. The smaller particles can start to irritate the upper respiratory tract, causing bronchospasm, so spasm or constriction of the bronchioles, causing bronchitis, as well as congestion within the airways, so making it very difficult to breathe. Some of the smaller particles can actually enter in deep into the lungs, in the alveoli, and this can cause some breathing problems and even potentially long-term problems. There's some phagocytosis that occurs to try to get that cleared out. It could potentially cause some damage, could cause some fluid buildup as well. So obviously limiting the gas exchange, the oxygen carbon dioxide exchange then within the lungs. Now there's very few studies on these fine particles, like I was alluding to earlier, because it wouldn't be ethically sound to expose a group of individuals to a lot of these particles at varying levels and see exactly what their performance is, because we know that some of this stuff can exacerbate pre-existing conditions, but also have very long-term effects on their health. So it's just not ethically sound. Ozone, or O3. So this is a double-edged sword. It's actually good for life. We need it in our atmosphere, but for health and for breathing in a lot of it, it's not very good. Now, UV light will actually act on exhaust fumes and creates the ozone. We can also have that ozone smell, almost like right after a rainstorm. That's an ozone smell. Now, this is a main component of smog. So this will peak during the hottest times of the day and the year because a lot of people are out and they're driving their cars. That UV light, that additional UV light, especially on hot days, is going to be reacting with the exhaust, creating the ozone. So again, that ozone is important, but having too much of it is not good. So there's a Goldilocks effect there. So the ozone inhalation can cause some respiratory discomfort, maybe some tightness in the chest, some neural inhibition of the inspiratory as well as expiratory control in the muscles that are involved in those processes. And these effects can be exacerbated during exercise then, obviously. So anything that is happening at rest that is causing discomfort is going to be translated to exercise, especially as we start to increase intensity. So there's going to be an increase in ventilation, and also the nasal scrubbing starts to decrease as well. So removing some of those particles that get into the nasal cavity as you're breathing. And ozone in performance. So there's a diminishment with endurance performance. So the VO2 max can decrease and the discomfort starts to increase over exposure time. There's some also psychological factors that start to limit the performance as well, because the subjects know that they're breathing in polluted air. So when we start to look at some of the studies that have been performed on pollutants, a lot of times the subjects know what they're getting, or they know that they're getting something. Ozone has a very particular smell to it. If you were to do a study maybe that had dust particles, somebody's going to know that they're breathing in dust particles. So those are some of the limitations with some of these studies. Now, is there an acclimatization to ozone or any other particles? Maybe to ozone, lasting approximately 4 days or so, but it's lost very quickly after the last exposure. And over here on the charts, you can see up here is the breathing decrement that has occurred with exposure, and also heart rate max, VO2 max, ventilation, and as well as exercise time. Exercising in urban environments, outdoors or out on the streets, on the west side. So we have an increase in exposure when we're outdoors, near highways, as well as anywhere near any type of sewage. Also, there is going to be a difference between non-peak hours and the midday. The non-peak hours, there's going to be less of this ozone and the less pollutants in the air, as opposed to the midday where all of the pollutants are in the air and they're being reacted with the UV light. So going out either in the morning or in the evenings is really the best time to limit the exposure. Now, indoors, there is a less chance of exposure because the air is filtered. It's a controlled environment. In fact, going back to the Beijing Olympics, there were multiple records that were being broken in Beijing in the indoor events versus the outdoor events, showing that the pollution actually had some effect, at least on the outdoor events, but not on the indoor events. Also, to keep in mind, in the indoors, in ice rinks, the Zambonis release a little bit of carbon monoxide, or at least they used to. I think they've started to clean some of that up now, but they used to release a large amount of carbon monoxide. And combining that with poor ventilation within the ice rinks, you had this carbon monoxide buildup, which can limit performance on the ice, whatever the performance may be. So managing air pollution for athletes. So some steps to take and prepare for this. So move training indoors if possible, especially in an air-conditioned, humidity-controlled environment, and if there's good ventilation. And also making sure that there's no new pollutants that are being added to that air inside. The acute exposure reduces the initial respiratory as well as the psychological responses, so it can have at least an acute effect on performance, at least in that short period of time. If there's any adaptation that does occur, it will be limited, and passive exposure really provides no protection. So there needs to be a long-term exposure for anything to be adapted, but really the best thing is to try to avoid it because the adaptation isn't prolonged and can be lost very quickly. There's also been some studies looking at antioxidants and reducing some of the stress. So antioxidants could be any type of vitamins that are antioxidants, and this helps to alleviate oxidative stress in the body, which is why they're called antioxidants. Now, there was no change with the antioxidants in pulmonary function, especially with increased levels of ozone, at least initially, but there may be a residual effect, meaning that as you increase the levels of antioxidants and maybe taking supplements or eating certain types of foods, that may help to counteract some of these pollutants and the effects, the negative effects that it's having on the body. All right, that was a fairly short chapter, exercise in polluted environments. Now get out there in a clean environment and go for a run. And I will see you in a second. So let me ask you a question. Have you ever smelled ozone? Most people have, or probably everybody has. They just didn't realize it. So ozone, you can smell it. And I think I mentioned it in the lecture. You can smell it in a rainstorm. If you go to Niagara Falls, people can smell that too. It can also be created. In fact, it actually has somewhat of a use. This is a device that I got. I think you guys know that I hunt. There's a lot of different devices on the market now that are used to create ozone. And this is one of them. This is known as the Scent Crusher. This actually came with a duffel bag. And there's also another bigger unit that creates ozone. The whole purpose of it was to create ozone and contain your clothes inside of either a bag or some type of small room or a container. And it helps to take away some of the scent. In fact, this actually works, at least for humans. Once we put ozone on something, now it can take away some of the smell. It basically deactivates some of the smell and some of the odor molecules on clothes or something like that. Now, it working in a hunting scenario with animals who have much better smell than us. I don't know. I bought it because I just wanted to try it. I'm a fool like that. I think it kind of works maybe in general, at least for us. Now this is kind of a side topic, but if you're a hunter, probably the only way that you're going to get around animals not smelling you is if they have a broken olfactory sense or you're downwind. So that's probably all it is. Or they just can't smell hardly any at all, like birds or, turkeys or something like that. Anyway, getting back to this. So this little device creates some ozone. This is actually plugs into your car, into the cigarette outlet or a power outlet, whatever you call it now. They used to be actual cigarette outlets where you could actually plug in the thing, the little lighter thing. But anyway, this plugs into the cigarette outlet and it emits some ozone. And it smells. I mean, it smells almost like a chlorine smell. And it's supposed to deactivate some of the odors. Again, that's what the whole purpose is. But actually breathing these in for long periods of time, we don't know the long-term effects of someone putting this in their car for a long time or using a lot of those things. There could be no effects. There could be some health effects. We don't necessarily know, at least at this point. I think it's one of those things acutely. It's not really going to harm you too much because we breathe in something like that, almost all the time, especially maybe during rainstorms. You kind of get that smell after a rainstorm or even before it. That's the ozone that is being produced. So long-term effects, I don't know. Now they can break down actual materials. They can break down things like spandex and things like that. So you need to be careful if you use any of these for, trying to deodorize clothes or anything like that. So again, there are things on the market where you can use that creates ozone and you can smell it for yourself there. So probably not going to be used for an ergogenic aid anytime soon, I don't believe. So we also got into some other ones. The biggest one there is carbon monoxide. That's going to be the biggest one that is going to cause a decrement in performance. It binds to hemoglobin. The oxygen carrying capacity of the cells goes way down, or of the red blood cells goes way down. So that binds to hemoglobin and it doesn't like to let go. It just stays there. So it takes a long time to actually get rid of some of that, especially if it's built up quite a bit. So you need supplemental oxygen for that. The other ones too, any type of particulates that are in the air, any type of, bacteria, or could be viruses, maybe during this period of time. Of course, that's something different that could happen as well. But any pollen too, anyone who has asthma and any sinus problems and allergies, they know that that's going to be a major, major performance decrement by breathing in a lot of those substances also. So anyway, that was the pollutants chapter. I hope you found it enjoyable. If you have any questions, don't hesitate to ask. I wonder if I could be like Uncle Fester and this thing will light up if I put it in my mouth. Just like, oh. Just joking. Word to your mother.